Welcome to ATCM, the Emergency Medicine channel. Today I'll be presenting a case of a 25-year-old female who presented to ER with alleged history of deliberate self-harm as she consumed 30 seeds of Abrus Precatorius with the outer seed cover removed 5 hours back. On initial 10-second assessment, patient is conscious, oriented, obeying commands. Primary survey, airway is patent, no gurgling sounds of stridor, breathing, air entry bilaterally equal, no added sound, saturation of 100% in room air and respiratory rate of 20 per minute, circulation pulse rate of 112 per minute, BP of 112/70 millimeters of mercury, capillary refilling time of 2 seconds, disability GCS was E4, V5, M6, pupils equal and reacting to light, moving all four limbs, GRBS was 95, exposure temperature was 97 degree Fahrenheit. Adjuncts of primary survey, we had taken a ECG which showed a sinus tachycardia. Secondary survey, this is a 25-year-old female who presented with alleged history of deliberate self-harm by consuming 30 seeds of Abrus Precatorius with outer seed cover removed 5 hours back at home.
5 hours back.
5 hours back. This happened following an argument with her mother and physical fight with her brother. She was taken to outside hospital and stomach wash was given, and she came here for further management. She had complaints of lower abdominal pain with left-sided chest pain. No history of any vomiting, hematemesis, hematochezia, any confusion, seizures, or altered behavior or altered sensory. No allergy to any medications, not on any medications, no past history of any illness. On examination, the patient is conscious oriented. CNS wise, GCS was 15 out of 15. Pupils were equal and reacting to light. There was no any focal neurological deficits. Abdominal wise, there was abdomen was soft, but there was tenderness in the lower abdomen, hypogastrium and right and left iliac fossa regions. Chest was clear, air entry was bilaterally equal, there was no added sounds. CVS S1, S2 was no murmurs.
Okay. So, what will you do next?
First, since initially if the patient had presented within 2 hours, we will have to start with the gastric lavage, and we will have to give activated charcoal for decontamination purpose.
Okay.
And
do we have any specific antidote for this?
Specific antidote, as such, there is no antidote.
There is no specific antidote for
previously
What is the mechanism of toxicity of?
It acts by binding onto the ribosomes.
So, what is the product? Toxin? Abrin is the product. So, you said in the history that she has removed the covering and she has taken it. So, what is the significance of that?
If the patient just swallows the seed as such, there will be less chance for toxicity. Okay. But if she crushes or removes the cover and takes it, it will be more chance for toxicity.
So that is the history that we got. But here, the classical history that we might get, the seeds were crushed and consumed. So that is the usual thing. So that history will give you an idea how much toxins the patient have taken inside. And Abrin, as you said, it's the ribosome, it will get affected. And as a result, what are the problems that we can anticipate? So we can start from the common problems that we need to say. What is the most common toxicity complications that we will see with Abrus Precatorius?
We'll have the most common one seen is hemorrhagic gastritis. The patient will present with abdominal pain with hematemesis, hematochezia, and because of that, secondary there will be profound hypotension, shock. Will be present.
So mostly it will be GI symptoms. The most common will be the GI symptoms, starting with nausea, vomiting, abdominal pain, and the worst scenario is in hemorrhagic gastritis, where they can go on to perforation. Or hematemesis, as you said. So that is the worst complication, and our challenge will be primarily to deal with the electrolyte disturbances and fluid management. So that will be the main problem with this group of patients. Next, what are the other set of complications that you can anticipate?
Cardiac arrhythmias can also be seen, or CNS effects such as seizures or any.
That's all rare. Cardiac arrhythmia. Compared to cardiac arrhythmia, it is not. It is CNS infection. CNS involvement is rare. So most commonly, the thing is GI symptoms. Renal failure.
Renal failure also can have.
Very rarely you can have renal failure also. So our aim is to primarily treat the patient. What is the toxic dose for this? How much?
90 to 120 mg of Abrin and 1 to 2 seeds.
1 to 2 seeds without 2 seeds crushed itself can be toxic.
Toxic dose.
So that is the most important thing that you need to look into. So what else you wanted to anticipate in this group of patients? What are the other problems that you will see?
Other problems we have to see for any co-ingestion of any other medications or any other products.
Okay.
And then cardiac monitoring And
the only
further-
thing that you should not taken away is that abdominal pain is due to Abrus. You should not be considering that. You have to look for the other cause of abdominal pain. What is the usual time duration for the symptom onset? Usually, what time you can safely discharge the patient now? Like 3 days usually, whatever be the manifestations is happening, it will happen within the 3 days, maximum within the first 5 days. So if at all the patient is recovering from that time, you can safely discharge them home. Usually it's the 3 to 5 days. That's the time frame that you need to know. So first 3 days, if the patient is not developing any major symptom, then they are safe to be discharged. So that is the most important history that you wanted to know. Then what was done for her?
Initially, since stomach wash was given from outside hospital, we had given here activated charcoal was given.
Okay.
And also outside they had given peg-leg solution for gas bowel irrigation.
Whole bowel irrigation.
Whole bowel irrigation was also done.
Was
We
it
had continued-
correct to give a whole bowel irrigation in this patient whom we are suspecting a probable problem with hemorrhagic gastritis and with lot of fluid loss that we are suspecting?
It will cause more of electrolyte disturbance.
Again, when it was given is the question. If it is given like immediately, may be helpful, but I don't feel we should be giving with the peg-leg enema in this patient. But definitely a gastric decontamination and gastric lavage, as you said, gastric lavage and activated charcoal when the patient would have presented initially would help. But the whole bowel irrigation, I don't think it has got much value in this case.
Other like if the toxidromes which we can face with the common plant poisons are can either be other causes are the cardiac glycoside plants such as we have the oleander and aconitin usually common that they will present with tachycardia without the anticholinergic or any nicotinic symptoms of nicotinic poisoning symptoms, and they will mostly have that arrhythmias arrhythmias will be there mostly common. And then there
You
will
can
be
have bradycardia with. Where all you can get bradycardia with plant poisoning? We have discussed few days back bradycardia. Which toxin can cause bradycardia? Plant poison again. Heart blocks. Very common in Kerala, Alapi region and all. We have discussed.
aconite.
Not aconite is not very common. Aconite is more in the north. They use it for a lot of Ayurvedic preparations and all. Odalam toxicity. We have discussed that. Cerebra odalam. So that is they can come with complete heart block again. So that's another one.
Then anticholinergic poisoning can also happen with datura and atropa belladonna because of the belladonna alkaloids. So they will present with the anticholinergic features of dry mouth, urinary retention, tachycardia, and symptoms will be there. Then other one is the nicotinic poisoning plants are there, which presents with muscle weakness, fasciculations, bronchospasm, diaphoresis, or any bronchial secretions or oral secretions. Those group we have to suspect for nicotinic poisoning. Then cyanide poisoning, we'll have to suspect with cherry red skin, tachycardia, hypotension. Then other uncommon like burning and swelling of oral mucosa, there are Aracaceae family plants are there. Then this
so
one
ornamental plants is there, no? We had seen a lot of ornamental plants we keep usually inside. Usually what the ornamental sort of a plants we'll keep, and usually they can have, the children can go see fantasy and they can just eat it. That is again very toxic, ornamental plants. But just one or two leaves, if they are chewing and consuming itself, is dangerous. So we had one case report recently, not recently, I had a call recently regarding the same, but likely there was no issue. So ornamental plants, whatever keep, I don't remember the scientific name. So those group of plants is also very dangerous. The leaf itself is dangerous. They can cause metabolic acidosis, lactic acidosis and all. And another thing that we said regarding this Abrus Precatorius is that they can have, sometimes the patient can present with anaphylaxis also, because it's a foreign object. There is a background history of atopy and all. They can suddenly have present with anaphylaxis sort of a presentation. So that also we need to keep in our mind, because previous background history of significant allergy, atopy, everything is there, and they have consumed this plant and they can just present like anaphylaxis. So when sometimes they will deny the fact that they have consumed this. So we have to ask, then only we'll come to know. So that's a very rare presentation. For just the sake of completion, I have added it. So our aim when such a patient comes in is to keep them hydrated well, maybe symptomatic proton pump inhibitors, and very rarely you need an endoscopy and all those things. But rarely they can need, sometimes they can go into perforation complications and all. Hemorrhagic gastritis, that is the classic autopsy finding also, that the whole mucosa is friable and the whole mucosa is totally damaged. So that is the classical autopsy findings that you will see with Abrus Precatorius when postmortem has been done. Okay, do you have anything else?
A similar presentation can also be seen at resin,
Dressing, okay.
castor
Castor seeds.
seeds.
Okay, fine. Thank you.
Thank you.